Hi, today we're going to talk about medial epicondyle pain. Sometimes it's referred to as golfer's elbow. Sometimes it's referred to medial epicondylitis. It's a little bit of a misnomer because normally when you end up having pain on the inside of your elbow, itis implies it's an inflammatory phase, which only lasts around 3 days. But people have this pain from climbing for weeks, months, and even half a year up to a year, and yet they still continue to climb. So what's going on in the inside of your elbow, and why do we end up feeling a lot of pain on the inside of our elbows? On the outside is called the lateral epicondyle. The inside bone of your humerus is called the medial epicondyle. The very tip of your finger, where it's attached to the base of that distal phalanx, that is a tendon called the flexor digitorum profundus, and that actually does not attach to the inside of your elbow here. It attaches, becomes a tendon, it travels all the way down and inserts right into the proximal ulna, right? So if you could see where this little red section is here, that's where your fingertip, what allows you to do this motion here. That fingertip, like doing a true open hand crimp, you're going to be engaging a muscle that's roughly attached to the inside of that proximal ulna. Now, why do we feel pain on the inside of our medial epicondyle? There's a flexor tendon that connects to all these different muscles here. On the medial epicondyle, there are actually 5 different muscles that are attached to this region here. One is your flexor digitorum superficialis, and that actually connects to the base of your middle phalanx, right, of all of your 4 fingers here. That tendon will travel all the way down, doesn't connect there, it actually connects to the medial epicondyle. So we're using a lot of that when we're climbing. We're doing a lot of half crimping positions. You also have your flexor carpi radialis and flexor carpi ulnaris. The radialis side, this is your radius, and here is your ulna. Your flexor carpi radialis attaches to the base of your second and third metacarpal, and that will also travel all the way down into and attach to the common tendon of the medial epicondyle. Also have the flexor carpi ulnaris, which connects to a lot of different areas here. Part of it is your pisiform, but mainly into the base of your 4th and 5th metacarpals. And that muscle also travels down and inserts into that common tendon of that medial epicondyle. Another muscle that's not really too often talked about is the palmaris longus. You can't really see it on the bone attachment because it connects more to the superficial tissues. Some people don't have that muscle, but other people do. And it's actually, if you tense your palm, you can actually see that little tendon popping out. And that is also another muscle that attaches to the medial epicondyle. And lastly, your Pronator Teres. So the Pronator Teres allows you to pronate your wrist, and you can actually see this little bump right here, and that cuts across and allows, it actually attaches to the radius, but it travels down and once again connects to that area. It's confusing, right? Because a lot of times when people have that pain, they're not really sure how to strengthen it. A lot of times people end up just doing those dumbbell curls, thinking that that's gonna help to resolve the issue. Partly it will, right? But a lot of times when you have your hand closed, you are actually utilizing a lot of your finger flexors to help with wrist flexion. So it's gonna mask the weakness of your wrist flexors, right? And wrist flexion is actually really important for slopey climbs. Let's say there's a slopey edge right here, and you're trying to grab onto it with your hand. Or even if you're trying to grab onto it in this position here, right? As long as there's no little edges here that allows you to like crimp onto that sloper, this is gonna really require a lot of wrist flexion strength. Sometimes we're overutilizing that half crimp position, so the superficialis is very strong, but your wrist flexors, so the flexor carpi ulnaris and flexor carpi radialis, those muscles have a tendency to not be as strong, and that is also another indication why you may be having pain on the inside of your elbow, because although your finger flexors, like we're grabbing big jugs, we're grabbing like small edges, we're concentrating so much on our fingers that we neglect the strength of the wrist. Pronator teres, for whatever reason, I have a tendency to see a lot of weakness in the pronator teres. So that's that muscle that allows you to pronate. And that can also be masked by, if you close your hand and turn in this way, there's a lot of these wrist flexors, finger flexors that are helping to assist with pronation. But if you isolate that, full extension of the elbow, extension of the wrist, and then really force yourself to turn in this way, try to resist that pressure. A lot of times there can also be some pain there. So the pronator teres is another culprit of why we end up having pain on the inside of our elbows. So what are some ways that you can actually help to develop more resilience and some strength to the inside of your elbow? It's actually practicing easier climbs that are going to stress your weaknesses, right? And so climbing on slopers that, not your most difficult level of climbing, but you want to try to reduce it down to an easier level and try to start working on wrist flexion there. So even grabbing those big slopey holds and seeing if you can try to engage more of your wrist flexors, not so much about like just using your fingers to stay on the wall, but engaging more of those wrist flexors and sinking down and really trying to utilize that, your weakness potentially. And the more you practice that, just naturally it's going to get stronger. You can also work on simple exercises with medicine balls. So this is a 6.6 pound medicine ball, or you can even use light kettlebells, right? Because your hand is going to be wrapped around the ball portion of the kettlebell, and you can just do simple wrist flexion curls like this to start building up some strength to those wrist flexors, right? Not just the finger flexors. The moment you grab a dumbbell, right, and you're doing something like this, yeah, it's going to help, but once again, the strength of your finger flexors are going to dominate with flexing your wrists. So you want to try to utilize your wrist flexor, try to isolate those wrist flexors, and by holding a ball that causes your hands to remain open really helps to get a lot of that, to negate those finger flexors and truly work on building up some strength to the wrist flexors. I hope that helped. Please share with anyone that might have some pain on the inside of their elbow, and I'm gonna try to continue to post these videos of different injuries of the fingers, wrists, elbows, even shoulders. So be on the lookout, and I'll see you guys. Bye.